Good evening, doctors. Today I am going to teach you about one of the most important topic, that is mechanism of the labor, that is indirectly, that is cardinal movements of the labor. Before going to this cardinal movements of the labor, first we have to know about the diameters of the skull, the diameters of the pelvis, then we can come to the mechanism of labor. Now first I will teach the diameters of the skull. Before going to the diameters of the skull, we have to know what is vertex, what is brow, what is face. Now listen here, doctor. This is anterior fontanelle and this is the posterior fontanelle. Midpoint of anterior fontanelle is called as bramah. Midpoint of posterior fontanelle is called as lambda. Now vertex means it is the quadrangular area. You can see I marked with a red and white. It is a quadrangular area bounded anteriorly by bramah, posteriorly by lambda, laterally by two parietal eminences. So this quadrangular area is called as vertex. Understood now? Vertex is, this is a quadrangular area, anteriorly bramah, posteriorly lambda, laterally two parietal eminences. Now listen here, doctor. For the time being, please remember two words related to vertex. So vertex means always flexion and occiput. So I will tell you why flexion and occiput. For the time being, you remember vertex means always flexion and occiput. Then after knowing the vertex, we will come to the brow. What is brow? Brow is nothing but one boundary is anterior fontanelle and coronal suture, and another boundary is root of the nose and supraorbital ridge. So this area is brow. So brow is nothing but sensiput. Brow is nothing but sensiput. Understood no? So brow is one boundary is anterior fontanelle with coronal suture. Another boundary is root of the nose and supraorbital ridge. Understood? So brow is nothing but what? Sensiput. Now you come to the face. What is face? Face means one boundary is the root of the nose and supraorbital ridge. Another boundary is submento. What is submento? That is junction of the floor of the mouth and neck. So this area is face. Understood? So once again I will be showing in the doll. So if you see this doll, see, listen here. So anteriorly bramah, posteriorly lambda. This is the parietal eminences. So this quadrangular area is vertex, and so brow means one boundary is the anterior fontanelle and coronal suture. Another boundary is supraorbital ridges and root of the nose. So this area is the brow. Brow represents sensiput. And face is one boundary is supraorbital ridge and root of the nose. Another boundary is submento. You can see the white marking, submento. That is junction of floor of the mouth and neck. That is the submento. So the area between the submento and supraorbital ridge and root of the nose. This area is face. Now listen here, doctor. One thing I told you, for vertex, two words. One is flexion and occiput. In the same way, for face, two words, that is extension and mentum. Understood? Now with this, we'll pass on to the AP diameters of the skull and transverse diameters of the skull. Now listen here. First we'll discuss about the AP diameters, then we'll come to the transverse diameters. Now listen here, doctor, before going to this AP and transverse diameter, I want to tell you what is presentation and what is presenting part. Now listen here, presentation means the part of the fetus which occupies the lower pole of the uterus. Understand? The part of the fetus which occupies the lower pole of the uterus is presentation. We have got three types of presentation. One is cephalic presentation, another one is podalic or breech presentation, another one is shoulder presentation. Now what is presenting part? So presenting part is nothing but most dependent part of the fetus. most dependent part of the fetus which felt on internal examination, that is vaginal examination. We are going to feel some part of the fetus. That part of the fetus is called as presenting part. Understood? Now in cephalic presentation, the presenting part can be vertex or can be face or brow, depending upon the degrees of the flexion. Understood? No? Once again I will be repeating. So presentation means the part of the fetus which occupies the lower pole of the uterus. Presenting part means it is the most dependent part of the fetus which felt on vaginal examination or internal examination. In cephalic presentation, the presenting part can be vertex or brow or face, depending upon the degrees of flexion. I told you, in flexion, vertex, in extension it is face. I told you two words for vertex. One is flexion and occiput. Another one, two words for face. One is extension and mentum. Another one, extension and what? Mentum. Now I will be continuing with the AP diameters and transverse diameters of the fetal skull. Listen here, doctor. I was telling you, vertex means flexion and occiput. Face means extension and mentum. Now listen here, doctor. We have got two types of flexion. One is complete flexion, another one is deflection. In both these two attitudes, that is complete flexion and deflection, vertex will be the presenting part. Now we'll come to the complete flexion. Complete flexion, the diameter will be, AP diameter will be suboccipito-brachmatic, that is 9.5 centimeter occipito-anterior. Once again I will be telling, complete flexion, suboccipito-brachmatic, 9.5 centimeter occipito-anterior. Now deflection, it is occipito-frontal, 11.5 centimeter, 11.5 centimeter occipito-posterior. So occipito-anterior is suboccipito-brachmatic, occipito-posterior is, what is it? Occipito-frontal, 11.5 centimeter. So in these two attitudes, complete flexion and deflection, presenting part will be the vertex and cephalic presentation. Now come to the face. Face means extension. So once again it is submento-brachmatic, 9.5 centimeter complete extension. Face is the presenting part, that is face presentation. Now face means it is extension, complete extension. So submento-brachmatic, 9.5 centimeter. Next, another one extension, that is partial extension. So partial extension, the diameter will be mento-vertical. So if you see this doll, so for partial extension, so mento-vertical. So mento-vertical means from mentum to highest point on the vertex, that is 13.5 centimeter brow presentation. I think, doctor, this is clear for you. Now listen here. So now vertex means two attitudes. One is complete flexion, deflection. For complete flexion it is suboccipito-brachmatic, 9.5 centimeter. For deflection it is occipito-frontal, that is 11.5 centimeter occipito-posterior. For face presentation it is submento-brachmatic, 9.5 centimeter complete extension. And for brow presentation it is a partial extension, mento-vertical, that is 13.5 centimeter. Understood? No? Now this is about the AP diameters of the fetal skull. Now the largest AP diameter is mento-vertical, that is brow presentation. Understood? No? The largest AP diameter of the fetal skull is what it is? Mento-vertical, that is 13.5 centimeter for brow presentation. Understood? No? Now with this AP diameters, we will go to the transverse diameters. Now listen here, doctor. So the transverse diameters of the fetal skull is, one is biparietal. So distance between two parietal eminences, that is biparietal, 9.5 centimeter. And bitemporal. So this is the bitemporal, distance between two temporal eminences, that is bitemporal, that is 8 centimeter. Another one diameter, doctor, you have to know, that is supra-subparietal diameter. Supra-subparietal. Supra-subparietal means, listen here doctor, this is a biparietal diameter. Supra-subparietal diameter means, so this is the supra-subparietal. That is the distance between point below one parietal eminences and point above opposite parietal eminences. So you can see very easily in this. Listen here doctor. So this is a biparietal and this is a supra-subparietal. Supra-subparietal means distance between point below one parietal eminences and point above opposite parietal eminences. That distance is called as what? Supra-subparietal diameter, that is 8.5 centimeter. Now listen here doctor, this biparietal diameter will be the engaging transverse diameter in gynecoid pelvis, and supra-subparietal diameter will be the engaging transverse diameter in platyploid pelvis. I will tell you what is engaging diameter and diameter of engagement in further classes, but you have to know number. This in gynecoid pelvis engaging transverse diameter, it is the biparietal. In platyploid pelvis engaging transverse diameter will be the supra-subparietal, that is 8.5 centimeters. I do know, and largest transverse diameter of the fetal skull is biparietal, and largest AP diameter of the fetal skull is what it is? Mento-vertical partial extension 13.5 centimeter. Understood, which is brow presentation. So this is about vertex, brow, face, presentation, presenting part, AP diameters and transverse diameters. And most common presentation is a cephalic presentation, and most common mal presentation is a breech, and most common mal position is the occipito-posterior. I was told, you know, occipito-posterior means what? Deflection. Occipito-frontal is the diameter 11.5. So complete flexion means suboccipito-pragmatic 9.5 centimeter. So this is about. Now after knowing about the fetal skull, now we will discuss about the pelvis. Now listen here doctor, this is the brim. You all know this is the brim. The pelvis above brim is false pelvis. The pelvis above brim is what it is? False pelvis. The pelvis below brim. So this is the pelvis below brim is true pelvis. Understood? No? For obstetrically important pelvis is true pelvis. Now listen here doctor. This articulated disc is composed of 4 bones. One is 2 innominate bones or 2 hip bones. Another one is sacrum. Another one is coccyx. 2 innominate bones, sacrum and coccyx. This hip bone is formed by fusion of 3 parts. One is ilium, ischium and pubic. Ilium, ischium and pubic. Understood? These are the 4 bones which constitutes this articulated disc. Understood? And I was telling you, the pelvis above brim is false pelvis. The pelvis below brim is true pelvis. Now listen here doctor. This true pelvis has got 3 parts. One is pelvic inlet. One is pelvic inlet. Another one is cavity. Another one is cavity. Another one is outlet. Now comes, we'll discuss about pelvic inlet. In pelvic inlet, we have got 3 diameters. One is AP diameters, another one is transverse diameters, another one is oblique diameters. Now we will discuss 3 important AP diameters. For 3 important AP diameters, the common point is the midpoint of sacral promontory. Now listen here, from upper border of pubic symphysis to midpoint of sacral promontory is true conjugate. It is, what is another names for true conjugate? True conjugate is also known as anatomical conjugate or conjugata vera. So it is upper border of pubic symphysis to midpoint of sacral promontory. Now the next AP diameter is from, listen here, from the midpoint of posterior border. See, I am marked them with white marker. So from midpoint of posterior border to midpoint of sacral promontory. So midpoint of posterior border to midpoint of sacral promontory is what? Obstetric conjugate. And from lower border of pubic symphysis to midpoint of sacral promontory is diagonal conjugate. So true conjugate is upper border of pubic symphysis to midpoint of sacral promontory. Obstetric conjugate is from midpoint of posterior border to midpoint of sacral promontory, and diagonal conjugate is from lower border of pubic symphysis to midpoint of sacral promontory. Now listen here, among these three AP diameters, the diameter, that is the conjugate which can be measured. See, this is the way of clinically measuring the diagonal conjugate. So the only conjugate which can be measured clinically is what? Diagonal conjugate. So diagonal conjugate will be of 12.5 centimeter. True conjugate will be of 11.5 centimeter, and obstetric conjugate will be 10 centimeter. Now listen here. So the conjugate which can be measured clinically, they usually give in the NEET exam with like this image. They used to keep there like this. So what we are going to trying to measure, it is the diagonal conjugate. Now with the help of diagonal conjugate, we can get obstetric conjugate. How? If you subtract 1.5 centimeter from diagonal conjugate, it will give obstetric conjugate. If you subtract 1 centimeter from diagonal conjugate, it will give true conjugate. I told you, no. So diagonal conjugate will be 12.5 centimeter. If you subtract 1, it will give a true conjugate, that is 11.5 centimeter. In the same, if you subtract 1.5 centimeter from diagonal conjugate, it will give obstetric conjugate. So obstetric conjugate will be 10 centimeter. So this is about the AP diameters of the pelvis. Now listen here, doctor. Obstetric conjugate is the shortest AP diameter of the pelvis. That is another one obstetric importance. One obstetric importance of diagonal conjugate is the conjugate which can be measured clinically. And another one is the shortest AP diameter of the pelvis is obstetric conjugate. Now we'll come to the transverse diameter. It has got only one transverse diameter, that is distance between two iliopectineal lines. It is transverse diameter, which is of 13.5 centimeter. Now if you see this transverse diameter lies posteriorly towards the sacral promontory. Means it lies 4 centimeter in front of sacral promontory. This is about transverse diameter. Now doctor, another most important diameter of the pelvic inlet, that is oblique diameter. What is oblique diameter? Doctor, oblique diameter is nothing but same-sided sacroiliac joint to opposite-sided iliopubic. See, this is a white marker. Opposite-sided iliopubic eminences. Means right oblique diameter means right sacroiliac joint to left iliopubic eminences, that is right oblique. So left oblique means left sacroiliac joint to right iliopubic eminences, that is right oblique. So it will be of 12.5 centimeter. Understood? This is about the inlet. Now if you come to the cavity, listen here doctor, this is the cavity. So cavity is bounded above by the inlet and below by the outlet. Now listen here doctor, in cavity we have got two planes. One is plane of greatest pelvic dimension, another one is plane of least pelvic dimension. So among these two planes, obstetrically important plane is plane of least pelvic dimension. Now listen here doctor, we will come to the plane of greatest pelvic dimension. Listen here, what is this plane of greatest pelvic dimension? This plane passes from midpoint of posterior border, posterior. So midpoint of posterior border to junction of, so junction of S2, S3 sacral vertebrae. You can see that red marking. So midpoint of posterior border of pubic symphysis to midpoint of, that is junction of S2, S3. So this is plane of greatest pelvic dimension, and this is the single plane. Understood? No? And it has got AP diameters and transverse diameters also. These AP and transverse diameters of the plane of greatest pelvic dimension will be of 12 centimeter each. AP diameter also 12 centimeter and transverse diameter also 12 centimeter. AP diameter is nothing but what? So midpoint of posterior border to junction of S2, S3. Understood? That is AP diameter, and transverse diameter is distance between the two farthest points on lateral wall. So this can't be measured exactly. Transverse diameter of the plane of greatest pelvic dimension can't be measured exactly because there is no specific anatomical landmarks. Understood, no? So plane of greatest pelvic dimension, you know, that is midpoint of posterior border to junction of S2, S3. So AP will also be 12 centimeters and transverse diameter will also be 12 centimeters. Now you come to the plane of least pelvic dimension. Listen here, doctor. This plane of least pelvic dimension passes from lower border of pubic symphysis to tip of both ischial spines. Tip of both ischial spines and posteriorly to tip of S5 sacral vertebra. So this is the plane of least pelvic dimension. Now this has also got both AP diameter and transverse diameter. AP diameter is from lower border of the pubic symphysis to tip of S5. And so from lower border of pubic symphysis to tip of S5, that is 11.5 centimeter, and transverse diameter is distance between two ischial spines, that is interspinous diameter or transverse diameter or bispinous diameter. All the three are same. So transverse diameter of plane of least pelvic dimension is nothing but interspinous diameter or bispinous diameter, which is of 10.5 centimeter. Now the common question asked in the exam is, what is the obstetric importance of plane of least pelvic dimension? And listen here, in the NEET exam they will ask you, what is the bony landmark for plane of least pelvic dimension? It is ischial spine. Indirectly, obstetric importance of ischial spine. One obstetric importance is from ischial spine levator ani muscle originates. That is a one thing. Second one, external os lies at the level of ischial spine. Then third one, internal rotation takes place at the level of ischial spine. Fourth one, pudendal nerve block analgesia is given at the level of ischial spine. Understood? No? Pudendal nerve block analgesia is given at the level of what? Ischial spine. And fifth one, doctor, whenever this deep transverse arrest usually occurs at the level of bispinous diameter. So deep transverse arrest occurs at the level of what? Bispinous diameter. Another one, most obstetrical importance, by palpating the ischial spine, we can see the station of the head. We can see what? Station of the head. If the head is above ischial spine, it is minus. If the head is below ischial spine, it is what? Plus. Understood? This is the one important obstetrical importance of what? Ischial spine. Now this is about the cavity. Now we'll come to the outlet. Now listen here, doctor. If you see this outlet, this is that outlet. This outlet has got two important triangles with a common base formed by a line passing through two ischial tuberosities. Understood? No? So outlet is formed by has got two important triangles with a common base. That base is the distance between two ischial tuberosities. Now listen here, doctor. This is the anterior triangle and posterior triangle. Now this outlet has got once again AP diameters and transverse diameters. So AP diameter is nothing but lower border of pubic symphysis to tip of S5. Understood? No? So lower border of pubic symphysis to tip of S5. Sorry, lower border of pubic symphysis to tip of cos6 is AP diameter of the outlet. Understood? No? Now come to the transverse diameter of the outlet is nothing but intertuberous diameter. Understood? No? Intertuberous diameter is nothing but transverse diameter of the outlet, that is distance between two ischial tuberosities. Understood? No? Now this intertuberous diameter will be of how much? 11 centimeter. And this AP diameter of the outlet will be 10.5 centimeter when the woman is not in labor. Now, so that is AP diameter of the outlet will be 10.5 centimeter when the woman is not in labor. Now see, doctor, when the head is coming through the outlet, means when the woman is in labor, so when the head is coming through the outlet, what happens? So the cos6 will be what? Pushed backwards. That time AP diameter will be increases. So that time AP diameter will become 13 13 centimeter. Not in labor 10.5 centimeter. In labor 13 centimeter. And listen here doctor, clinically how will you assess this transverse diameter of the outlet? This clinically it will admits minimum of 4 knuckles. What it is? Minimum of what? 4 knuckles. Understood? Okay. So this is about inlet, cavity and outlet. Understood? In this you have to remember about the AP diameters of the inlet. In cavity you have to remember about 2 planes, that is plane of greatest pelvic dimension and plane of least pelvic dimension. Among this plane of greatest pelvic dimension and plane of least pelvic dimension, plane of least pelvic dimension is obstetrically important plane because of what? What is the diameter? Interspinous diameter and ischial spine. And outlet, that is transverse diameter of the outlet, it admits 4 knuckles clinically. And AP diameter of the outlet will be 10.5 centimeter not in labor and 13 centimeter when the woman is in labor. I am going to teach you 2 important things, that is position and denominator. Now listen here doctor, in the beginning of this class I was telling you that vertex means it is flexion and what is the bone? It is occiput. Face means it is extension and what is the bone? It is mentum. Now listen here doctor, before going to the position you have to know certain things in the pelvis. Listen here, this there will be the anterior quadrant of the pelvis and posterior quadrant of the pelvis. See, for the sake of understanding, I am telling. It is not given in any book. For the sake of understanding of position, I am telling. So, anterior quadrant means iliopubic eminence. Understood, no? And posterior quadrant means, listen here, and posterior quadrant means always it is sacroiliac joint. Understood, no? So anterior quadrant means it is always iliopubic eminence. Posterior quadrant is sacroiliac joint. Now listen here doctor. Now see doctor, this is the occiput. You all know this is the occiput. Now listen here, if the occiput is anterior, see occiput is anterior. Anterior means what? I'm telling you anterior quadrant means what? Iliopubic eminence. Understood, no? Now listen here all, this is left side doctor, so this is left side and this is right side. So occiput, doctor, occiput is anterior, so now this is left occipito anterior. Understood, no? Now listen here, occiput is anterior means iliopubic, posterior means sacroiliac. So now it is, what is the position of the doll now? Left occipito anterior. Now doctor, in the same way, if the occiput is posterior, see, a posterior means what it is? Sacroiliac joint. Now it is left occipito posterior. Understood? Left occipito posterior. I am telling you, occiput means what? It is flexion. No, fetus is, the doll is in flexion. Now come to extension. So extension means what it is? Extension means what? Face. Now listen here doctor, if the extension, now listen here, so like this, extension means it is mentum and face. Now it is, mentum is in towards iliopubic eminence, means left mento anterior. Now in the same way, if it is posterior, so fetus will be like this, correct, no? So if it is mento posterior, left mento posterior. So understood? Next, come to the breech. So breech means always you have to remember the sacrum. Now listen here doctor. So sacrum is towards anterior, means iliopubic eminence. So it is left sacro-anterior. If the sacrum is posterior, posterior means what? Towards sacroiliac joint. That is left sacro-posterior. Understood, no doctor? So once again I will be repeating. Anterior means iliopubic eminence. Posterior means it is sacroiliac joint. I was telling you. So vertex means it is occiput. Face means mentum. Breech means sacrum. So understood, no? If the occiput is anterior, means towards iliopubic eminence, means left occipito anterior. This is right occipito anterior. This is left occipito posterior. In the same way, doctor, if you come to the face presentation like this, So this will be left mento-anterior. So right mento-anterior. Understood? No? This is left mento-posterior. If you come to the breech, understood? No? If you come to the breech, so if the breech is towards anterior, means left sacro-anterior. If it is posterior, left sacro-posterior. Understood? No? Now listen here, doctor. This left occipital-anterior, right occipital-anterior, they are all called as what? Position. No? So position is nothing but arbitrary point on, listen here, arbitrary point on fetal presenting part in relation to different quadrants of pelvis. And listen here, overall most common position is left occipital transverse, and second most common position is left occipital anterior. Now listen here, doctor, I was telling you, if the occiput is here, left occipital anterior. If the mentum is here, left mento anterior. If the breech is here, left sacro-anterior. Now listen here. So with the help of, if occiput is anterior, left occipital anterior. If the face, that is left mento-anterior. If the breech is here, left sacro-anterior. This occiput, so this mentum, this sacrum, means with the help of these three, we are going to determine the position. Yes, with the help of occiput, with the help of mentum, with the help of sacrum, we are going to determine the what? Position. So these occiput, mentum and sacrum, they are all called as denominator. So what is the definition for denominator? It is arbitrary point on the presenting part. Understand? Arbitrary point on the what? Presenting part. So presenting part means in vertex, what is the presenting part? Yes, our vertex is a presenting part. What is the arbitrary point on the vertex? Occiput. In the face, what is the arbitrary point? It is mentum. In the breech, what is the arbitrary point? Sacrum. So this mentum, sacrum and occiput, they are all called as denominator. With the help of denominator, we are going to assess the position. With the help of denominator, we are going to assess the position. And for listen here, for brow presentation, it is the frontal bone is the denominator. And for shoulder presentation, it is the acromion is the denominator. Okay, doctor, with position and denominator, next I am going to tell you about two things. One is engaging diameter and diameter of engagement. Doctor, listen here, doctor. Engaging diameter means always it is fetal diameter. Always it is fetal diameter. And diameter of engagement, it is the diameter related to the pelvis. It is maternal pelvis. So see the question properly, whether they are asking engaging diameter or diameter of engagement. Understood? No? So engaging diameter, it is always related to fetal diameter, and diameter of engagement always it is related to the pelvis. Understood? No, doctor? So now with this, we'll pass on to the cardinal movements of the labor.